Human trafficking. In the state of Ohio, it is a tragic reality. Every day, men, women, and children are trafficked. They are the victims. And healthcare providers are uniquely positioned to come in contact with and identify those victims. A 2012 study of emergency department professionals found that less than 3% of those surveyed had received any formal training on human trafficking. That less than 20% were confident they could even define human trafficking. Just 5% were confident in their ability to identify a victim of human trafficking, and only 7% were confident in their ability to treat a victim of human trafficking. On March 29, 2012, Governor John Kasich signed an executive order creating the Ohio Human Trafficking Task Force, which recognizes that the training of healthcare professionals in identifying and treating the victims of human trafficking must be a priority.
It's first to learn the basics of what it is, and then what it looks like in Ohio, and then to understand the red flags that they may see, and then know what to do from there.
What is human trafficking? The simple definition: it is modern-day slavery and is the compelled service of others for profit. Human trafficking exists in two forms: sex trafficking and labor trafficking. Both forms have been found in Ohio. Labor trafficking occurs when men, women, or children are forced to work against their will through the use of violence, threats, lies, debt bondage, or other forms of coercion. Studies show that migrant workers, both documented and undocumented, are particularly vulnerable to being exploited by labor traffickers. Labor trafficking can be found in a wide variety of industries. And a recent case here in Ohio showed that the agriculture and food processing businesses are places where large numbers of people can be trafficked.
This past year, we had the investigation that revealed that there was a large trafficking case going on with the egg farms in Marion and other kind of counties around central Ohio. So we had initially 43 victims of trafficking who were identified through the egg farm case, and then others have kind of come to light since that time.
What are the indicators of labor trafficking that medical professionals need to be aware of? When a victim shows up at your emergency room, clinic, or office, the first thing you may notice is that they may be accompanied by another person, who may be their trafficker or an associate. As you ask questions, the trafficker may attempt to either coach the victim's answers or not let them talk at all, or translate answers if the victim does not speak English. The trafficker's goal is to control the situation, while revealing as little information as possible about the victim.
They will be short and forceful in what they want because in the end, they want this medical attention, this medical problem to be addressed, they want it treated, and they want to leave.
As you gather the patient's history, there may be many indicators that would identify your patient as a victim of human trafficking. They may appear to be malnourished or in generally poor health. Depending on where they have been working, you may find they suffer from back strain, have broken bones, or injuries related to repetitive motion. You may also notice other signs of physical abuse, including bruises, black eyes, burns, or cuts.
In that history gathering, you'll get more details of what do you do, who do you work for, are there any concerns with where you work, and are you able to financially support yourself and your family here. They may present with something completely unrelated, but in gathering further information about their social situation, you may pick up on indicators that they are working in a situation that's not ethical.
When you offer to help the patient and treat their injury or illness, they may resist or demonstrate fear. They may be afraid of physical harm from their trafficker or possible arrest or deportation.
It may be that they know that they are being watched and guarded. Their answers are not forthcoming, and they may also be very reluctant to provide accurate information. Their story may not add up. It may change.
What to do if you suspect that a patient is a victim of labor trafficking? It is important to note that safety concerns for your patient, colleagues, and the public should be addressed in your facility prior to the first time you identify a potential victim. If you do not know your facility's protocols for alerting security in cases such as this, be sure to get that information from your facility administrator. The crime of human trafficking is a first-degree felony. Reporting it is mandatory. All mandated reporters must report suspicion of sex and labor trafficking to law enforcement. The first thing medical professionals should consider in confirming that a patient is a victim of labor trafficking is to arrange a private conversation with the individual without jeopardizing their safety. This means trying to separate them from their trafficker. If the patient is 18 or under, citing hospital rules or protocols regarding minors can be an effective option.
Framing it in a form of, we do this with all teenagers, it's our protocol, may be helpful, but we definitely want to speak with that individual alone and try to then get the history from them. And you may not get much more of a history, but taking that opportunity is crucial in finding out the truest information you can.
The questions you ask will be driven by the private interview and should help you make an informed conclusion. You may ask if they have ever been forced to do work they did not want to do. Are they in debt to their employer? Have they or their family ever been threatened with physical abuse in order to make them stay in their job? Have they been lied to about the type of work they would be doing? And have they been threatened with deportation or jail if they tried to leave their work? If you can't separate the victim from the trafficker, you will need to keep the questions more generic, such as where does the patient eat or sleep? Do they have ID or a passport? Can they leave their job if they want to? What should you listen closely for in the victim's answers? They may sound canned or rehearsed, which is a signal to try and dig a little deeper to get better information. Asking open-ended questions can be helpful, like, what would happen if you leave your job? Victims will often avoid making eye contact with you or be evasive in answering. Whether the interview is done in private or not, its purpose is to show the victim that you can be trusted, that you are here to help, that their safety is your first priority, and that they will get the attention they need. Conducting an assessment exam with a potential victim. When you conduct an assessment exam with a patient you suspect is a victim of labor trafficking, there are several ways to proceed. First, be sure to utilize your hospital or clinic's existing protocols for dealing with victims of abuse, and use existing culturally sensitive protocols as well. If you are interviewing minors, be sure to use age-appropriate language. Try to conduct the interview in a comfortable space that offers confidentiality, and if it is appropriate, separate the patient from their belongings and other individuals. If you notice that the patient is wearing or carrying a GPS transmitter, cell phone, or other electronic tracking device, try to get them into a gown and an X-ray room in order to separate them from these devices. And if the patient is a female, the approach should be made by a female staff member, whether a psychologist, physician, or social worker.
We have to be careful when we identify someone that we think ahead of time. What will we do in our situation, in our own clinic, in our own emergency departments, wherever we practice? That we have a plan in place so that when we identify someone, we can make the right phone call to the right people who can respond as quickly as possible and keep this person safe.
If you believe that the victim is in immediate threat of harm, do not delay. Call 911 or your on-site security immediately. If you have additional questions about how to report a suspected trafficking situation for adults or minors, please contact the State Medical Board of Ohio at 614-466-3934. You may also find points of contact in your area's Human Trafficking Coalition by using the map at humantrafficking.ohio.gov. You can also find sample protocols for meeting the needs of minors and adult survivors.